Hello, my name is Monica Mathis, and I'm an MD that specializes in mental health. And for the last 10 years, I've worked with individuals who have different mental health disorders. And currently, I work at UT Southwestern and provide assistance and medical care for individuals with a wide range of different mental health diseases and disorders. The disease that I currently work closely with is epilepsy. I see about 1 in 26 people that come into the clinic who have epilepsy. It is a disease of the nervous system where the brain is affected. It causes the patient to experience convulsions and temporary loss of consciousness. It is caused by uncontrolled bursts of electrical activity sent to the brain. And the initial treatment that I've used for my patients have been effectual drug therapy like general anticonvulsants. If the seizures aren't controlled after full trials of 2 or 3 different anticonvulsants, then surgery would be considered as the next step. Before surgery, we would perform an electroencephalography for the patient to make sure that surgery would lead to more improvements than damage in the patient. This is trying to see and monitor where these electrical impulses are being sent to the brain to figure out which areas of the brain are being affected. So this test will allow a neurologist to locate the damaged cells from these seizures, and if the area damaged could be surgically removed without causing damage to the patient's speech or motor areas, then surgery would be performed. There are 2 different types of surgeries that we could perform. We could perform a hemispherectomy to remove just part of the brain, or we could perform a corpus callosotomy, and this would cut the corpus callosum in between the left and right hemispheres to keep the electrical signal from passing from one side of the brain to the other. One patient of mine that I'm currently treating for epilepsy is a 10-year-old Caucasian male. At the age of 9, he began to have seizures every couple of weeks, and before the seizures began, he was a completely healthy child with no past medical history for anything. Currently, I have been recommending a low dose of carbadotrol twice a day. This treatment has decreased his seizures and the frequency of his seizures, but has yet to stop them. So I am recommending to increase the dose of the carbadotrol, and it is my hope that this will stop the seizures, but if not, we will try switching him to a new medication. Overall, epilepsy cannot be prevented, but the frequency of the occurrences of the seizures can be. It is important that we go ahead and educate individuals with epilepsy to know the different things that can trigger a seizure. These are different things like stress, anxiety, alcohol or drug abuse, missed prescribed medication doses, and overstimulation of the senses. It is also important that we educate other healthcare professionals treating patients with epilepsy. It is important for them to know to take the reserved treatment routes. So this would be starting with some medications, and if those don't work, switching to a new medication before we even consider any type of surgery. And lastly, I do see a need for educating the general population about what to do when they see someone having a seizure. This can be a life-threatening event, so we do need to make sure that people know what happens and how they can help an individual who has collapsed and having a seizure. Thank you.